And you see here one case we did in 2017. You see a thick wall phenotype. The tooth has been very carefully extracted, and then the socket explored. Yes, everything is as expected. Then we prepare the implant bed through the surgical guide. We insert the implant, and we measure ISQ 76. Then we put a healing cap on and do an internal grafting. And when the grafting is done, the provisional crown is actually providing the primary wound closure because it's sealing off the soft tissue wound. Here you see the patient at a 1-year follow-up. This bone level implant is very well integrated. The buccal bone situation, the buccal ridge anatomy looks very promising. Here you see the 2.5-year follow-up, and the patient allowed me to take another cone beam, and you see the buccal bone wall is fully intact. So a very pleasing case. Then a more recent patient we did in 2019. We have further improved the technology. Now actually we produced already the provisional crown with CAD/CAM technology. You see very favorable anatomy. The facial wall is thick. Now we are using the so-called BLT implant of Straumann because this further optimizes the primary stability of the implant. The planning is done, then the matching is done, the position is selected. It's always a compromise between the prosthetic needs and the anatomic needs. Then I agree here with Dr. Samir Abu-Ayyash on the correct positioning. The surgical stand is produced, and then we do the surgery. So we extract the tooth very carefully, and then we prepare the implant bed, put the BLT implant in, and measure ISQ 81. Very typical, high value. And then we do the grafting, and then the pre-prepared implant crown is adjusted clearly out of occlusion, no contact to neighboring teeth at the contact zone, and the patient leaves the clinic with a provisional in place. And now, of course, the soft tissue healing is done beautifully around the emergence profile of this crown. Here you see the patient at 3 months, perfect healing. See Samir Abu-Ayyash, a top orthodontist in our dental school. And then we went into final restoration. Here you see the lady I saw the last time in last November. Due to Corona, I didn't have a chance to see her again. We will do that now. And you see an excellent outcome with this. So I'm very pleased, gives me a chance. We did about 25 patients. In 2 patients, ISQ was not 70, and then we could not restore the case with a provisional crown. So that helped us extremely.